She's been referred to in the news in the past few months as the fattest woman in the world. Well, she's already well on her way to losing that title. Originally weighing just over 1,100 pounds, after not leaving her home for over 25 years, 36-year-old Eman Ahmed reportedly had to have the walls of her room demolished so she could be lifted out by a crane, flown from Egypt to India in a specially modified Airbus. Docs at a Mumbai hospital put her on a 1,200 calorie a day liquid diet to help her lose enough weight to safely get into an elevator and ultimately on an operating table for bariatric surgery. We were surprised by this, but reportedly, after losing only 220 pounds, which is a lot, but after that weight loss, reportedly underwent a laparoscopic sleeve gastrectomy and is said to be recuperating well. And I'll tell you, 880 pounds, that's unheard of to do a surgery on someone of that size.
We had her drop the weight first, and we know that she also has elephantiasis, lymphedema.
Can I ask a question? Like, if her issue with the excess, the weight isn't due to overeating. She has a parasite, it's lymphedema, so why were they shrinking her stomach when it's not due to overeating?
Well, they're just trying to get her to lose weight overall. I think some of it was water weight that they probably got off her, but just by restricting her caloric intake with that size of body, she dropped crazy amount of weight.
And that's an interesting element to this story, and a lot of people may not realize this, but if you're someone who has a lot of excess body fluids, when you lose that initial weight in the hospital, it's not just tissue, it's oftentimes a lot of water weight. You raise a really interesting point with elephantiasis. It's not like a gastrectomy is going to change that disease process. There's a lot to be.
But is it likely, Travis, that the standards are different in another country outside of the U.S.? Like, are they using a different surgical procedure? Is there something we should know about?
India's a major destination for medical tourists. A lot of people travel to India to get surgeries performed at a much lower cost. There's probably some element, and we said this the first time to this, that is publicity. It's bringing a lot of publicity to the ability of these doctors to perform surgeries that probably would not be performed elsewhere. Is
Maybe
it for publicity?
encouraging people to travel to India if they have
Well, they're
lots
trying
of
to
weight.
promote their medical tourism, but there's some very highly skilled surgeons in India, and they have the technology as well.
And if she ultimately has a good outcome, you have to say kudos to these docs because they saved her life if she.
Bed she was in?
Well, she even had the surgery, so she's doing better than she was when she was laying in the bed in
Nobody would have touched
home
her
for 25 years. That kind of isolation has to be just devastating.
Well, obviously our
lifesaver.
hopes, thoughts, and prayers are with her that she does have a good recovery and can maintain or regain some quality of life. We'll be right back.